Ciao belli, I'm now 16 weeks pregnant, and at 9 weeks I graduated from my fertility clinic. The clinic I chose for my treatment is called Olive. It's a very renowned clinic here in Vancouver. Overall, I had a good experience. I was assigned to Dr. Taylor, and comparing my experience to other people, I found it strange that throughout the year I was at the clinic, I only saw Dr. Taylor through 2 video calls, 1 phone call, and that's it. Whenever I had a visit at the clinic, I was always seen by a different doctor. I did 3 IUIs. For those who don't know, they basically take the sperm, they clean it, choose the strongest swimmers, and then inject it in your uterus when you're ovulating. Something I realized most of my female friends didn't know is that there's only 1 day during your menstrual cycle, which is when you're ovulating. That's when you can get pregnant. That day, and you count the days before and a few days after, that's the window where you can get pregnant. If the window's passed, you are not fertile. Very interesting that you can get pregnant only basically 12 times a year, once a month. I did 3 IUIs, which were around $800 each. I was going for a 4th IUI, but a medicated one. So they call this a mini IVF. I was doing injections in my stomach, a very low dose compared to a full IVF. I went in for my ultrasound before the procedure. We found out that I developed too many follicles. So the doctor gave me 2 choices, either to skip the cycle or switch to IVF. This was very stressful because I thought I already spent almost $2,000 on these medications. I developed 6 follicles on one side and 4 on the other side. Who knows, maybe with a full dose of IVF medications, I would have developed double that. So double the chances, right? So it was a gamble. The toughest part of this whole process was egg retrieval. It was really painful. Even though they gave me some sedatives, I still felt pain. And after I went home, I think my body knew that I needed to recover, and I slept for I don't know how many hours. The embryo transfer happened a month after, and it happened so fast. Like, you go in, you sit down, they show you the embryo, which is this tiny little thing. Through the ultrasound, they show you that they insert it, and then you see it on the screen, and that's it. And then you just wait. Throughout this whole process, I had to do intramuscular injections in my lower back every 3 days, alternate right and left. That was really hard because I had to do it by myself. My partner, he has very shaky hands, and the needle had to go in the muscle. It was very long and thick. I remember that my back was constantly bruised. You have to do them at night, but you can't go to sleep right away. You have to move, but sometimes you forget. So the day after, you wake up with this big lump, which is kind of painful, bruised, not an easy ride. But here we are, 16 weeks in. Something I regret not doing was doing the genetic testing on the embryos before they froze them, just to have a peace of mind. So the embryos that I have left, I don't know which ones are healthy, which ones are not. Around 10, 11 weeks, I did the NIPT test, which is a blood test where they find out about any genetic diseases, trisomies like Down syndrome. Oh, here. It's called non-invasive prenatal screening. It has a very low false positive rate. The test that I did was to test Down syndrome, Edwards syndrome, and Patau syndrome. And you also find out about the gender of the baby. When we graduated from the fertility clinic, they gave us this bag, which contains information about the NIPT test, which I did through my midwife's clinic. I appreciate reviews. And then they gave me a pregnancy outcome form. And this little so small. Of course, with the logo of the fertility center. Marketing never sleeps. But it's so small. This is the first piece of clothing that I have. I hope this was informative, and if you have any questions or comments, please leave them in the comment section below. Grazie. Ciao.